Back to York, Carolina. I have a question for you. Do you have a relationship with your primary care provider? Having a primary care provider is essential to helping you stay healthy and preventing potential health problems. Our next guest, Dr. Jessica Clark, is a primary care physician with Bon Secours Premier Family Medicine, and she's joining us this morning to explain why it's important to establish that really good relationship. Good morning, Jessica. Good to see you.
Good morning.
The doctor is in the house.
She is. I just wonder, do doctors like being called doc?
It's fine.
Does it bother you? I just wondered all these years.
You know, if I went through all that school, I would be like, you better call me a doctor. Like, make sure you say that. I put all that time and learning in there. But today we're going to talk about the question that I'm sure you guys are really asking a lot. Do you have a relationship with your primary care provider? Why is that so important?
So it's really important because a lot of diseases are actually silent. You can have high blood pressure, never know it, you don't feel it. And that puts you at risk of heart attack and stroke. So the only time you would know that is if you're going to the doctor, having your blood pressure checked.
Having a physical every so often.
Exactly, yeah.
And that relationship
and to go to, like, you're our primary care physician, but to go to a specialist, you have to be referred, I think, by.
So it depends on your insurance company.
Okay.
But yeah, some insurances do prefer that you go to your primary care provider first,
Then let them set it up.
and then we refer you.
How important is that conversation? Because with any relationship, you need to make sure you have some sort of like rapport with the person that you're talking to. Would you advise people to come and meet some of your staff and really, because you're very friendly and nice, and you want that out of someone who's going to be in charge of your health and really managing that for you?
Yeah, so I think it's dependent on the person. Some people do come in and they almost kind of interview us, you know, to see if they even like us. But then some people, you know, or they're moving into the area, they already have established problems and they're just really needing someone to take over their care. So, but if you meet a provider and you just don't feel like it's a good fit, there's plenty of us, so we're all happy to take care of them.
Your practice, do you practice within the Bon Secours hospital system?
Yes, I do. Yeah, our office is in Greenville, South Carolina at Premier Family Medicine. But yes, we are under the network of Bon Secours.
Where is that?
It is off of Butler Road. If you're going off of 385, exit 34.
Yeah, great. Well, routine health exams should be there, right, for most people? Yes,
we do recommend those once a year. And then if we do have chronic problems, and that, you know, dictates how often we see you in between those appointments.
Gotcha.
And obviously people want to catch it before it gets there. What types of preventative things do you guys suggest people do before?
So all of the cancer screening, so colon cancer screening usually starts at age 50, depending on your family history. If you have an early family history of cardiac disease, then, you know, that's another conversation too. Then one of the newer things is if you were born between 1945 and 65, it's actually recommended you be screened for hepatitis C. So, you know, a lot of those things maybe you wouldn't know, but as a provider, we would be there to guide you for that.
And most people are like, oh, I don't need to be screened for that, but that's important.
It is important.
That window, for sure.
It is.
Well, with a primary care physician, you can learn about side effects. All drugs, I'm assuming, have that.
Yes, they do, unfortunately.
Even aspirin.
Yes, it does.
But again, with you being our doctor, we can learn about drug interactions too.
Yes, and we can always be there to answer the questions about the possible side effects, you know, if it would put you more at ease.
Right.
And we see physicals, and they're kind of scary for a lot of people. What is a physical? And usually kids get them when they're doing, like, you know, sports and things like that. Right. Adults are like, well, I don't need. I've been going 15, 20 years and don't need one. What is that, and why does everyone need one?
So a physical is when you can come in and do all of your baseline blood work, and that's actually where a lot of things are picked up, like what I was saying with the silent disease processes. You know, sometimes high triglycerides, you don't feel that, but we find it on the blood work, and that's when we would do that, would be at your physical.
And let's talk about MyChart. Like, everything's so digital these days. People want to be able to access things wherever they are. Tell us a little bit about the MyChart system.
So MyChart is actually really great because you can pull up all of your labs, you can pull up all of your images. So if you ever are going to another facility or another doctor, and if they can't see your results, you can just bring them with you. And it does make for better patient care and better continuity. And that way things aren't repeated. You know,
at least today I know things are so much quicker. You can go to see one doctor, and by the time you get to the other one 2 days later, it's all right there in front of them on the computer. It's amazing.
And now you can take control of your own health by having it right there with you. So when you go somewhere, you can already have it.
Are you taking new patients?
I am. Okay. We actually have 3 providers in the office right now, and we are all accepting new patients.
That's great.
Awesome. And locations all over? How can we find the locations?
So you can actually go to bonsecours.com, and that'll tell you all of the different outpatient family offices that we have.
That's great.
We were asking, since we have you here, we're asking about the elderberry syrup. What is the doctor's take on the elderberry syrup?
Well, I actually don't have much of an opinion on the elderberry syrup, but I hear it tastes awful. But I also hear that it works.
Okay.
So,
well,
anecdotally, it's probably fine.
But also, you can just come see the doctor to maybe prevent getting to seeing them often and getting.
I bet if you go to see her with a cold, she's not sending you home with an elderberry syrup.
No, probably not.
Whatever makes you feel better.
Right. Thank you, doctor. We appreciate you for coming and giving us that great information. The number is on your screen, 864-610-5639. So definitely get in there, get a healthcare provider, and learn more information about all that they're offering at Bon Secours.
You are right.
We have more show coming up.